Hi everyone, I'm Arian A. Villaspin and your student nurse for today. And for today's video, I'm going to show you how properly assess the male genitalia and the rectum. Okay, before we proceed, be sure that we perform proper hygiene. We use a pair of gloves, provide privacy to the patient, and explain the procedure to the patient. And okay, let's start. Assuming that this is the male genitalia of the client or the patient, and first inspect the base of the pinnic and pubic hair for growth pattern and exuration. Inspect also for the erythema or infestation while the client is standing, and the nurse should be in sitting position. Number 2 is inspect the skin of the shaft, this one, for rashes, lesion, or lumps. Number 3 is to palpate the shaft for hardened areas of tenderness. 4. Inspect the foreskin if present for color, location, and integrity. Inspect the glands of size, shape, lesion, or redness location in the urinary meatus on the glands. If uncircumcised, ask him to retract his foreskin to allow for observation. 6. Palpate the urethral discharge by gently squeezing the glands between the index finger and the thumb. By doing this one is the glands. Gently squeeze. Then assess for any discharge. What color of discharge? If any discharge, we must note and document. And next is assessing the scrotum of the patient. Inspect the size and shape and position. Penis is held out of the way. Observe swelling, lumps, or bulge. If there is any swelling, the signs are enlargement or redness. So if we notice any swelling or any enlargement of the scrotum, we must document it and note for it. Number 3 is inspect the skin for color. Also inspect the skin for color, integrity, and the presence of lesion in any. Assess for any nodules and swelling in the scrotal area. Number 5 is transilluminate the scrotal content. If a mass or swelling was noted, look for a red glow. Spread out the scrotal folds of the skin to perform an accurate inspection. Lift the sac to the inspection in the posterior skin. We should spread it like this and separate so we can properly assess and observe the skin folds if there is any rashes or any abnormalities, discoloration in the scrotal area of the patient. And number 4 is palpate the scrotal content, testes, and epididymis. Between your thumb and first 2 fingers, note size and shape, consistency, and presence of tenderness, nodules, and next is the anus. So, assuming again, this is the anus. At the back of the scrotum, this is the anus of the male patient. And the perineal area, this side. Inspect for any lumps, ulcer, lesion, rashes, redness. Note for size and shape if we detect some abnormalities like lumps or any rashes or any ulceration. And then And number 2 is inspect the sacrococcygeal area for swelling, redness, dimpling. Assuming that we are assessing the inguinal area of the male patient, number 1 is to inspect the inguinal and femoral hernia, watching for bulge while the client bursts down. Number 2 is to palpate the inguinal hernia, observing the bulge of muscles. Have the client shift weight to the left to the palpate and the right inguinal canal. Place the index finger into the right scrotum, this one, and press upward to the slit-like opening of the external inguinal ring with finger in canal or external inguinal ring. Ask him to bear down or cup. Repeat at the left side. Number 3 is palpate the femoral hernia on the front of the thigh in the femoral canal. Ask him to bear down or cup while feeling for bulge. Repeat on the other side too. 4 is inspect and palpate the scrotal hernia. If mass was detected during the inspection and palpation in the scrotum, ask the client to lie down and note whether the bulge disappears. If it remains, auscultate it for bowel sounds. Then gently palpate the mass and try to push it up in the abdomen unless it's too tender. Okay, and then the next is the anus and perineal area. Assuming again that we are assessing the anus and the perineal area of the female patient, of the male. And the last is the rectum and prostate. Palpate rectal mucosa for tenderness, irregularities, texture, nodules, and hardness. Palpate peritoneal cavity for tenderness or nodule or rectal shape. Assuming that this is the rectal area, of course we need to palpate and then observe the rectal area for any lesion or any ulceration or any abnormalities that we don't usually see in the rectal area. If there is any abnormalities or any signs of lumps, ulceration, rashes, we must document it. And the last is inspect the feces for blood and perform occult blood tests. And this is the end of our assessment for male genitalia and rectum. Thank you for watching.